Our researchers don't give up, and I won't give up. I love being in this room full of strong women who say, here's an issue, it must be addressed. Part of this is personal. My mother was in the hospital for a little surgery, and she was going home the next day when she sat up in bed and said to my daddy, oh, there's that gas pain again, and then fell back dead. And the autopsy showed that she had advanced coronary disease, which had never been diagnosed and, of course, never treated, because back then nobody knew that women had heart attacks too. We're not going to be treated like second-class citizens in healthcare. We must also face the hard truth that research on women's health and gender differences lag far behind the research on men's healthcare. And too often, even the policy conversation around women's health lags as well. This is how we work together to make real differences in the world, and that's what we're going to keep doing.
Senator, do you think we need any new federal laws to address these issues, or is it more regulations that the FDA or NIH can set?
I think we're going to push in both directions. If the NIH puts new regulations in place that demand better parity in the research, that will be a big step forward, and we don't have to wait for legislation. If the NIH is reluctant, then it's appropriate for Congress to step in. But I'm really hopeful on this, that the NIH will move in the right direction. Today, we now have prescriptions for sleep medications that are calibrated differently for men and for women. They're actually described differently, and you're told something different. That's probably just the first of many that will head in that direction, but we've got to have the research to back it up.
Senator, is it going to cost more to include women equally in research?
I want you to think about what it costs not to include women in research. When women aren't treated appropriately for coronary artery disease, when women aren't treated appropriately for Alzheimer's or for depression, the costs are immeasurable. Getting women in on the front end so that we get better treatment is the most cost-effective thing we could do.
Senator, can we jump topics for just a moment and we talk about Ukraine? Your thoughts, and do you believe that maybe we should have gone in a little earlier? As far as I know, Senator Kerry is headed, or Secretary of State Kerry is headed over there right now. Should we have maybe gone a little earlier?
It's an unfolding situation, and that's what makes it really tough. This is not a case where we're seeing change day by day. We're seeing change hour by hour here on what's going to happen within Ukraine and what's going to happen in the surrounding region. I'm very glad that Secretary Kerry is headed there now. He has been speaking with leaders over there, but he's going to be on the ground, and I think we'll know something more after we hear back from the Secretary.
Are you getting feedback from your colleagues? Is there a high level of concern?
There's a great deal of concern, and we're talking about it, but as I said, the information keeps changing. The situation is very fluid at this point.